Great time over there. So, all right, let's get started. We got Aaron Warwick is going to present MLSS. Rob Mock thereafter will lead a discussion on the Reddit short busting trend trade. Jonah Lupton had to reschedule. He had some personal last minute things that came up. So we'll reschedule Jonah Lupton's top 3 picks from Lupton Capital in the near future. The trade of the week, we're going to do first our trade of the month winners. Then we'll do last week's winners on trade of the week. The trade of the month, the January trade of the month we did ended up being very successful. And then we'll do this week's picks for trade of the week. So we should end on time because of the rescheduling of Jonah Lupton. So we'll aim to finish right on 10 o'clock. Quick disclaimer, Story Trading is not an investment advisor. Investing in securities involves significant risk of loss. We are recording this session for the 2 prepared remarks, the presentation parts. Once we get to the trade of the week, we'll turn that recording off. There are no plans to post this on social media. This is just for our paid subscribers. And with that, featured presentations. Rob, are you here? Let me just give you permissions. You can give us a quick update on the performance, and we'll turn it over to Aaron Warwick after that.
So yeah, overall performance is still around 60%. We have 58%. Atomera is the top of the board. That's enhances microprocessors. Then Summer Infant that makes all of the baby devices doing very well. A lot of people jumped in that, up about 150%. Unity Florian's pick. I think Florian wasn't able to get in that one, even though it was his pick. I think he mentioned us, so we might. So it's great that he found a killer pick, but it jumped up the morning, so we might have to remove that from the chart in the future. And then Sultan presented BCRX. That's one of our top picks. I want to say before we had people presenting like Sultan and Dan Carlson, I was always wary of touching pharmaceutical type picks, but to have their knowledge and background, it like gives us the confidence to invest, get good returns, and they find the safe picks within that space. So that's good. And then Real Networks is moving up the chart slowly. It has a great product and it started off very cheap, so could still go a long way. And INMB, if that drug gets approved, that one could fly. And just many, many good picks still on the list. And we're still positive about all of these. And the only ones in our group that stay red are the ones that were just presented and they have bright futures. Sometimes the ones at the bottom in the red have like the biggest possible gains later on, so don't discount those ones. That's about
it. Also don't forget Aaron's pick, I believe is INTZ. He closed that out at up 175%. So that's actually, we may have to modify this chart to just indicate, I don't know, we'll have to look at that to make it more clear. So anything you see on this table, these are still active. Any of those presenters who feel they're, the stock is overvalued, let us know. We'll remove it from this list.
Actually, P2QQF, I think their shares were frozen on Friday, and they said there's a possible acquisition.
All right, awesome.
We'll have to see.
And with that, we can turn it over to Aaron. Here's a quick chart while we wait for his audio visuals to get up. This is a long term. The stock's been around. It's like a 15-year chart right there. Monthly candles. And
hey guys,
we're ready for you, Aaron. Yep, we hear you.
Good deal. Good deal. Yeah, so I hadn't even thought about it. I'm sorry, guys, that I hadn't presented Milestone earlier. You can see it is up. I think I got in around 180, got some more when it dropped to 150. But I still think it has some room to run. It is still a decent size position of mine, and one that I think will be keep my eye on for some time to come. So I'll just begin. I like to be informal on these. So I have stuff out there on Seeking Alpha, and I'm on the chat room. So I'm happy to answer any questions. But I'm not here, to like to pump the stock or anything like that, or to sell it to anybody. I just want to share research because that's what we do. So I was introduced to Milestone. MLSS is their ticker symbol. Back in December 2019 at LD Micro in California. And at that time, I was extremely impressed with the CEO, and I was actually really excited about what the company does. I'll explain what they do here soon, because it's something that would have impacted my own life, my own family. And they have enormous potential. But I felt like at that time it wasn't quite the right time to invest. I thought they still had some more work ahead of them, and it turns out whether it was luck or skill or whatever, I think I was right. Part of it, honestly, around July at one of the LE virtual conferences, and progress that they had made. Talked to the CEO again, was very impressed with what he had to say once again, and saw that there were going to be some catalysts coming up, and some of those are still ahead. Happen that the stock is taking off. Give you a background of the company. They do is they make devices that deliver. Currently, what they do is make devices that deliver pain medication in more efficient ways than the standard of care has been, and their primary business has been, up until this point, has been on the dental side. They have a dental division and a medical division. So the dental division, it injects shots to numb your mouth or numb your teeth, your gums, when they're doing procedures. And the difference between Milestone's product and the standard products out there is that Milestone, because of their computerized technology, is able to help the dentist identify exactly where they are inside someone's gums when they inject the shot. So rather than a dentist having to give you a shot and then come back in 10 or 15 minutes and see if you're numb, and then finds out, well, maybe you're not, so he needs to give another shot, or she needs to give another shot. And so this can go on for a while. I actually had one of my own kids. It took about 4 times before the dentist, we were there for an hour before the kid finally got numb enough that the dentist could do work. Well, with Milestone's device, you can put it in, the dentist can figure out from the computer exactly where they are, if they're going to deaden the nerves, and it takes about a minute, it's numb, and they can begin their procedure. So it saves the dentist a lot of time. As you can imagine, COVID-19 was not very friendly to this business when dentist office across the country, really a lot of them across the world, shut down for months at a time, and even after the shutdowns, though the business was very limited compared to what it was like before. Milestone was actually ready to sell their dental business right when the pandemic hit. And I'll get to their medical business, but it was to help fund their medical business, which is really the future, a much higher total addressable market and several different indications. But so COVID-19 stopped the transaction from going through. The reason being is that the bank at that time that was going to finance the deal with the buyer backed out, saying, there's too much going on. We can't close this transaction right now. I think it in the long run, it'll probably end up being a blessing in disguise for Milestone. It certainly was a good opportunity for someone like me that was on the sidelines, because what happened is, since they didn't get the money from the acquisition, what Milestone decided to do was to go back to the capital markets and raise a significant amount of money. The reason that they raised enough money to get through about 2 to 3 years to make sure that they had enough money to go to market to commercialize their main current medical products, as well as continue developing some of the products for these other indications that I'll mention here in a minute. So they don't have a need right now for any more capital raises. They're in good position right now on their balance sheet because of that. And of course, the stock was hit by that, which made it a good time to get in. So what's going on now is, first of all, the dental business has started to recover much more quickly than they expected that it would. And in addition to that, there's been some very positive developments on the dental side that I think, could end up giving them a higher valuation in the end for their dental business. But what I want to focus on, because it's really the future of the company, is their medical side. So on the medical side, what Milestone currently does, and they're just now starting to commercialize this product, but what Milestone does is they, when a woman is given an epidural, they replace the epidural when a woman is giving birth. And so, again, it's the similar kind of technology that they use on the dental side. It's all from the same technology, computerized technology. And so, what happens when a woman is given an epidural is that the anesthesiologist is basically guessing where he is in the epidural space, hoping that he gets the right space based on feel. It's done by how things feel in there as he's moving around trying to get the right spot. Well, as a result, there's significant morbidity rate associated with epidural procedures. And this is what I was talking about earlier, where it would have impacted our life. My wife decided to give birth. We've adopted a kid, so we have 4 kids, but she gave birth to 3 of them. And so she did all 3 of those births without any pain medication, because as a nurse practitioner, she was well aware of the morbidities associated with epidurals and just said it wasn't worth it. She would have loved to have had pain medication, but she didn't want to risk some of the things that can happen. The most severe being things like paralysis. Occasionally there is mortality associated with it. That's very rare. But there are a lot of other side effects more common that are like, you can have severe headaches for months afterwards. And, some women might say the worst side effect is the medicine just doesn't work because they didn't get it in the right spot. And so, again, it's very much like this dental side of things, where the physician may have to keep trying again. And every time, that you poke a big needle in the spine, you're taking a risk of some form of morbidity. So what Milestone's product does is, again, it allows you through the computer to see exactly where you are. If you're an anesthesiologist delivering this epidural, it tells you exactly where you are and exactly when you should go ahead and deliver the pain medication. And so, again, within a couple of minutes, then the woman has this pain medication. She's deadened where her senses are deadened there, so that there'll be much less pain associated with her giving birth. This is a huge cost savings for hospitals. It's a huge cost savings for anesthesiologists, because they have to pay a lot of money in insurance, and a lot of money that they have to give to patients that win lawsuits when they mess up and the woman has morbidity associated with the epidural. In addition to that, now what Milestone has done is they've developed so that product is called CompuFlow. The complementary product that's now used, and they really try to bundle these two together, and they use the same computer system, is called CathCheck. So it's very much related. What happens is when a woman's given an epidural, they put a catheter in and they leave it in there so that after she gives birth, they can continue to deliver pain medication as needed, and until ultimately it's time for the woman to get off of that and to go home. But what happens in this process, so even let's assume that the anesthesiologist is successful in placing the epidural and then the catheter, and it works without any problems, and she delivers, and the pain is severely dimmed compared to what it would be. Well, what happens is the woman gives birth, which is fairly traumatic on the body. She's moved around to several different beds by the time she gets to her final bed, where she'll stay for the rest of her hospital stay. And what happens is, again, even if the anesthesiologist did a perfect job, the catheter can accidentally be moved during all these transfers during the birthing process and so forth. And so what happens is the woman ends up, experiencing pain when the pain medication wears off. So when they give her more medicine through the catheter, if it's become dislodged or misplaced, then she still has pain. And so that's, the number one side effect. And number two, they have to go back in and try to relocate, which again has morbidity associated with that as they go back to try to put a new epidural, a new catheter in to help the woman with her pain. So what CathCheck does is it will warn the physician immediately when the catheter is in the wrong position so that it can be repositioned correctly, again, using their computerized technology. And so rather than, again, going back every 15 minutes, trying to decide, well, does the woman need more medicine, or is this actually misplaced now? Did it move in the process? The doctor knows immediately. In addition to, so that's currently the medical side of the business. There's also, I don't want to spend much time on it, but they're working on Botox injections. This is something that is also a doctor has to go by feel where to inject Botox. So a lot of things can go wrong there. They're working in the veterinarian market as well. With this, it's all based around their computerized technology and placement of needles. Now, the reason that I think today is a good time to invest, even after we've had this run from the $1.50 range in the last couple months, is because there's several upcoming catalysts that I believe will happen on the way to Milestone. I think that they will become the standard of care. And so just to give you an idea of where we're at now versus where we're going, I think if Milestone becomes the standard of care in the epidural space, you're talking about their earnings per share, according to the CEO on a conference call that they had not too long ago. They'd probably be looking at $1.50 to $2 a share in earnings per share, just if they were the standard of care in America. And I should note they also have some international presence and some trials and things going on in Europe. So this is something that will be international if it becomes a standard of care. And it may even become the standard of care, quite honestly, in Europe before it does in the United States. But what's coming now is just recently this year, actually, the first 2 weeks of January, Milestone had a flurry of press releases announcing various things that were going on with the company. One of those was a partnership that they now have in Europe, and another one is a hospital win, two hospital wins, excuse me, here in the U.S. One of them being the University of Texas medical branch at Galveston, and the other one being a regional hospital conglomerate in, I believe it was South Carolina. So neither of these were enormous, although the University of Texas medical branch at Galveston is a good win because they're going to be training future anesthesiologists in using this method. But what seems pretty clear when you talk to the company and based on what they've been working on, you can even see on their website some promotional stuff that's come out of Yale Medical School. And from the sounds of it, I think I would be surprised, put it this way, I would be surprised if they do not announce that Yale Medical School has begun to use their product and begun to train their medical students in their product sometime in the first half of this year. I think that's coming up. And I think it's quite possible that they will win some major hospitals as well, in addition to that, based upon what the company has told me and what they have said publicly about ongoing trials, expanded trials, and so forth. They're starting to get a lot of traction right now. So that's what I wanted to share on Milestone. I'm very happy to entertain any questions if we still have time for that.
Hey, Aaron, thank you very much for that very interesting presentation. I got a couple questions I want to start off with.
Yeah, and for some reason, I can't hear you very well. So I don't know if it's on my end or what, but.
1 second.
If you see my ear up to the phone, that's why.
Okay. Can you hear me now?
I could
A
hear
little
you
bit,
well
but
before, but
go ahead.
Rob, were you saying, is there something wrong with my audio?
no, I'm saying I could hear you well, so it might be just
Oh,
Aaron.
it's his connection. It's Aaron's
Yeah.
connection. Okay,
Yeah.
Aaron, I'll try to speak up so Aaron can hear
You could
me.
also type it into the chat if we have.
Well,
to.
I can hear you if I put my ear up. That's why I turned my video off so I can hear it. Something changed evidently when you guys made me the presenter. Before that, I could hear fine, but I can hear you. I just have to put my ear up to the phone. I don't think everybody wants to see my ear.
Okay. All right, great. So can you talk a little bit more about the computerized technology? What kind of technology are they actually using to make this work?
Yeah, I mean, you can go to their website. I mean, I'm just going to be honest with you. I don't know a ton of detail about it. They've got a lot of videos on their website that shows what they do. But the gist of it is that they're able to pick up. So like if you get in the epidural, if you get in the right place in the epidural sac, I think it's called, then you can detect a heartbeat. Okay, and one of the problems is when you use the method of feeling where your needle is, if you get into some fat, that tends to feel the same as the epidural sac or the epidural space. And so what their computerized technology does in the case on the medical side with the epidurals is it detects whether there's a heartbeat. And so it knows that if there's a heartbeat, that you're in the right space.
Okay.
But
All right, great.
they have a bunch of videos on their website that show that are for people that are interested in knowing more about it. And it's all patented stuff.
Cool. I'll take a look at that. My last question is regarding standard of care. Is that something that they just have to get win after win after win, and they end up having a certain percentage market share, and you call it standard of care, or is there some sort of association where you flip a switch and overnight there's standard of care because it's recommended by some organization? How's that work?
Yeah, so I can't say that I will answer this perfectly. A certain part of me, I just have to say I don't know. But I think I think there's a couple different ways that it happens. I mean, I think part of it would be, I'm sure there's some sort of an association of anesthesiologists that would recommend it or so forth. But a lot of it has to do with insurance companies. And so, there could be a point where insurance companies will just start saying, you have to change to using this method because we're not going to keep paying for this old method that was developed. I mean, this technology that's used now, just feeling around, is several hundred years old, and has all this morbidity associated with it that Milestone doesn't have. I mean, and they have all sorts of clinical trials that have been conducted that show that their method does. I mean, there's no morbidity with it. Basically, it's almost non-existent. And on one of their calls that they had, one thing that they've been doing here recently is like almost monthly, they have investor calls where anybody can just call in, and they usually begin by just explaining how the product works and things like that. And then they have questions at the end. And some guy asked a question. He seemed fairly knowledgeable, but he was basically saying that, I mean, there could be, the standard of care could sort of be forced on anesthesiologists by these insurance companies or by people suing, saying like, you have to allow this method to be used in this hospital because it's so superior to the technology that's currently being used and so much better for patients. There was actually a study that was done out of Texas Medical Branch in Galveston a while back and I can't remember the exact dollar amount, but that talked about the cost savings per patient. I think it was around $300 or $400 per patient. But if you consider how many births there are in the United States, how much money that's saving hospitals and insurance companies is quite significant.
Okay, great. Thank you for that color. Rob, I'll turn it over to you.
Sure. So if anyone has a question, click down in the middle of the screen at the participants section, and then to the right, there'll be a place where you can raise your hand on the box that pops up, and then we'll unmute you to ask questions. There is one question in the chat box from Daniel Soquera. Who is the largest competitor, and do they have to go through clinical trials, which can take years? Thanks.
Yeah, good question. I mean, no, they've already done all the clinical trials. And again, if you visit their website, they've got a ton of those up there. No, they're at the stage now where they're ready to commercialize. Their product has been approved and everything. And I mean, their only competition is the current standard of care, what anesthesiologists were trained to do, which as I mentioned earlier, is a very outdated at this point, to just feel around and obviously a lot of anesthesiologists do a good job doing that. It's not like 50% air rate, but the morbidity is high enough that, as I said, even people like my wife, who's a nurse practitioner, were like, no way. There's a lot of women actually, and it's been growing as more people become aware. Now with the internet and so forth, we can be aware of these things more than we were in the past. A lot of the younger generation is refusing to have these epidurals because they realize the morbidity rate that's associated with it, which I think is like 4 or 5%. That's a pretty high number. So no, they don't have any competition as it relates to that, other than just what the doctors are used to doing.
Okay, thank you. And we also have a question from Tom W. I'll ask to unmute you.
Hi, Aaron. How are you?
Hi, I'm doing well. How are you?
Thank you for the presentation. Interesting company. But I did have a question. I was looking at their sort of charts, looking back 10 years, and it doesn't look like the company seems to always like hit the $3 or $4 level, and then just kind of trail off from there. Can you give us a little bit color of the past and why this company just can't seem to get beyond that level? Or because it looks like they tried a number of times,
right,
never quite get there.
Yeah, so there's been a couple of problems with why they. I mean, first of all, as the previous question alluded to, you got to go through all sorts of clinical trials, and you got to establish yourself and then they've had to dilute in the past before because they need more cash to do that, and they don't. The dental business, I mean, it's okay, and it will be something that they'll be able to sell. It's a viable business, but it's nothing like. I mean, the dental business really shouldn't be a publicly traded company. They're publicly traded, I think, because they need the money to raise for the medical side, because you're talking a huge market there, and then in addition, you start talking about things like Botox and veterinarian market. You could start doubling and tripling the TAM. But one of the main things that they found, some of the pushback has been, number one, doctors and especially anesthesiologists. What Len Osser, their founder and CEO, says is the male ego, right? So basically, like, other anesthesiologists have this problem, but not me. It's not me. I know how to do it well enough. And of course, their product costs more upfront. So that's a hurdle. And then you got to go through capital committees and so forth at the hospital. What I've been impressed with here recently, and I started learning about what they were doing on this when I talked to them over the summer at the LD virtual conference. They've basically found a way to sort of bypass some of this stuff. Well, first of all, the price of their product has come down. They were able to make it cheaper now. And then the other thing that they're doing is they're working on some deals with some hospitals where you agree to they'll lease you their device, and you agree to purchase so many disposables, because it's a razor blade model. So the disposables is where they make huge margins. So what they do is they'll just either lease it to you, or they will even give it to you, and then they increase the price of the disposables accordingly. And so that way they're able to bypass some of the red tape, that you might have in big hospitals. The other thing is the cath check is pretty new. So CompuFlow, they found that with cath check, this is where I talked about how, because again, you remove what Len Osser calls the male ego from the equation here. when a woman gets moved around in birth and after birth and multiple beds, well, the doctor can then say, well, it wasn't my fault that the catheter got dislodged or was misplaced. It's because of all this moving around. And so now what they're finding with the cath check is more acceptance. And so it's using the same computer system to do as CompuFlow does, as the epidural does. So they're just saying, let's just do the whole thing. And so that has helped them make progress. And I think just there's a combination of factors that they're now at a point where I think it's all kind of coalesced together, and they seem to be making some serious headway. They do have some of these hospital wins. They have signed a couple of distribution partnerships. And so things seem to be moving in the direction where it's, now things are happening.
Sounds good. And now we have another question from John Cison. Are they widely covered by insurance companies? Now we're still getting coverage wins still. And he's mostly asking about cath check product coverage.
Right. Yeah. So my understanding would be that they are. And then one of the things that happens with, so they signed a deal, I think it was this must have been in 2020 with an organization, a distribution agreement with it. I can't think of what they call these companies, but they are, someone can put it in the chat if they think about it, but it's called Premier. But basically, like, Premier does all the vetting up front, so that if Premier offers this product, then hospitals know that it checks out, that the insurance is going to cover it, and that it's a safe product to use and so forth. They can basically bypass capital committees there as well, as my understanding, because Premier has already vetted any products that they offer in their channel. So that was a significant win for Milestone there, in my understanding from speaking with the company. They were extremely excited about that.
Sounds good. And does anybody have any last questions? I don't have any questions, but I have some comments. So my background is actually biomedical engineering. I've made catheters and other types of products, and like everything you've said makes perfect sense to me, because most medical devices make money on selling the peripherals and like pieces after they sell the medical device. I've been through a few births, and I know epidurals can be a big problem. My wife's epidural actually fell out before she was getting a C-section, and the doctors had no idea, so they were going to do that surgery, and she was like, I feel that, and they were like, oh, maybe we should check on your epidural, and it was just like running down her back. And definitely, I think I remember most births in the hospital, it was like a hospital in Connecticut, were waiting on the anesthesiologist. And if this could speed that up in any way, you'd be like speeding up all the procedures in the hospital. And I think anesthesiologists are some of the highest paid people, even beyond doctors in hospitals. So if you could have them be a little faster and more accurate, you decrease lawsuits, you speed up the entire hospital and all the births, and you kind of save money per patient. So I could easily see something like this, if it works, becoming a standard of care. I think great product.
I think that's where it's going. And everything you said is accurate to what my experiences have been in talking with many people before I even learned about this company. And for me, we always like to find a good investment. We always like to make money on it when you do it, when they're actually like, significantly helping people's lives in a way that almost all of us, even if we don't have our own kids, we have relatives that have kids. We hear people going through these types of things where they have an issue giving birth. So it's pretty cool to be involved in investing in a company that's doing things like this to move us forward.
Definitely makes sense. Even during the COVID trend, I was like, after the masks and the thermal detection, because I was like, these are really going to help people and people are going to need it. So they're going to sell a lot so you could help people and make money at the same time.
Right.
There is a comment. Gonzalez is asking, do you have any updates on PTQQF?
Oh, yeah. Well, I don't have an update other than I will just say, I've been thinking about it all weekend. I'm really not worried about it. The fact that they were halted, and I'll explain why. But it's just an interesting puzzle, like trying to solve a puzzle. And I've run it through my head several times, and I cannot think of any reason why the exchange would allow them to halt. The company halted, and it said that it was halted by the company request pending news. If it was any sort of financial or regulatory issue, I don't see why the exchange would allow the company to halt the stock. They might have to do it if the volume just went through the roof and they needed to settle things down and be a little more orderly. The exchange, I could see doing that. The fact that they were supposed to be releasing their earnings, their annual earnings, Q4 and full year 2020 earnings, and the fact that they had a press release 8 days before that, and it's hard for me to believe that an auditor would have found, like the night before they released them, that stuff wasn't already prepared. The board's already met. They've looked over the CEO's commentary and talked about the main points we want to hit and so forth. The only thing that makes any sense to me, and maybe we'll find something else out in hindsight that I haven't considered, is the only thing that makes sense to me is if they're making just an enormous merger of some kind, or acquiring some other much larger company than they normally do, which I don't think they would be doing, but that could be the case. Or if they got an acquisition offer that someone's acquiring them, that they just they couldn't refuse and needed the weekend to see if they can get the deal closed. Seems to be the only thing that would make any sense, especially going this whole weekend now without any press release, even after hours. Seems to me like the only thing that makes sense, but who knows? Well, the thing that we do know is that we can't get in or out of it right now. So
Guess we see what happens Monday.
Yeah.
I believe that was the last question.
Yeah, well, it's a great presentation. Very interesting company, Aaron. I don't have a position, but I'm going to be looking at it. So thank you for that.
Yeah, I wish you presented earlier. I've been seeing it in all the chats, but I never
didn't
jumped
even think
in.
about the fact that I hadn't presented on here, but hopefully people follow me on Seeking Alpha and on the boards.
Yeah, the presentations make a huge difference. I as well have been seeing you guys talking about it, but there's so much information overload.
Yeah, of course.
And
right.
This is a great way to stand out and get people to really understand the story. So really appreciate that.
Well, I have another company I have another company that's similar in terms of they've been doing a lot of R&D and trials, and they're about ready to. I think they're going to be commercializing and getting some wins, and I'm just going to talk to you, Ben, about presenting them maybe sometime in February. I'll be posting those on the boards probably later this week. Probably have an article out later this week on them. So anyway, I'll try to get ahead on that one.
Sounds great. Thank you, Aaron. Want to also let everyone know we opened up an MLSS research group. Steven, when you get a chance, you can drop that link in the VIP room here in the Zoom.
I just posted it in the Zoom chat.
Okay, yeah, later on, just post that in the VIP and WhatsApp, and we'll talk about MLSS a little bit further there.